Narrative Therapy for Grieving Individuals by Sean Brooks for Cornerstone University Techniques of Counseling. The technique I am introducing is called Narrative Strategies. A beautiful quote by Michael Schreiner is as follows: Narrative therapy uses externalizing conversations to separate the person from the problem in order to see the problem clearly and objectively, as something distinctly separate, something that can be dealt with on its own terms. Those that are grieving the loss of a loved one often feel guilty, alone, and anguished. How does narrative therapy help those that are grieving? Narrative therapy can assist in this greatly. Schreiner also states that in externalizing grief, we no longer are only seeing ourselves as a griever, but rather seeing grief as something that is its own entity. This is specifically useful because we can see something as its own entity and it is not a part of us. We can conceptualize it as something that we can overcome. We don't feel like we are the problem and that we cannot change. For this presentation, we will take a look at a specific strategy called retelling the narrative of the death. As someone that has worked in the hospice field, I can say from personal experience that more often than not, there are a lot of factors surrounding death. People don't always pass when they are done living their fullest life. Although this sounds like common sense, often it is hard to realize in the moment when a loved one is taken from you unexpectedly from disease and they are given less than 6 months to remain alive on this earth. More often than not, individuals are not able to just deal naturally, and they can't just work through it on their own. It seems to be a great cultural myth that we should be able to just deal with something like this on our own. What population would be able to find purpose in the retelling the narrative of the death tool? The person that has lost a loved one in an unexpected, violent, or harsh fashion. Guidelines for retelling the narrative of the death include retelling the story of the loss slowly for at least 10 to 15 minutes. It is beneficial to provide the story from when the death is undeniable up until when the loved one has passed. The individual may close their eyes during the storytelling and use pictures to emphasize the emotions about the story. This kind of process can help individuals figure out where their loss fits into the life story. Essentially, narrative retelling can make the individual feel validated for the issues they are facing. Many people are faced with silence or failed attempts to provide empathy to the individual. It is very crucial to stay with the individual when they are retelling their stories during their hardest times until they can face them with less anguish. Through the narrative process with a therapist, an individual can find that they are reliving events and seeing things in a way that is able to add to their life story. In closing, a quote by Michael Schreiner is one that is soul-touching. Grief is the multifaceted response to a change in a customary pattern of living. Thoughts and emotions are usually all over the map, and there is also usually a great deal of ambivalence.